This week, we talked about carbohydrate storage and disorders. We started off by looking at the poll questions, talked about metabolic syndrome, which is pre-diabetes, some of the symptoms that are associated or the factors associated with metabolic syndrome. You need to have at least 3 or more of these factors in order to be diagnosed with metabolic syndrome. And this condition may lead to type 2 diabetes and heart disease. However, if you can treat these conditions, if you can improve all these numbers, then you can definitely reduce your risk. I won't say cured, but you can control your risk of developing these conditions. I talked about normal blood sugar levels and how insulin and glucagon help maintain blood sugars in the body, how they react at the level of the liver and at the level of the cells to help maintain normal blood sugars. Sometimes there are issues with blood sugars. If it's too low, you can develop what's called hypoglycemia. And this is when blood sugars drop and the pancreas has to release glucagon. Glucagon targets the liver to break down its stored glycogen, release glucose into the bloodstream, and help maintain blood sugar levels in normal range. The opposite is what occurs when blood sugars go too high and insulin is released, which targets the cells to allow blood sugar into the cell and lower the levels in the blood. We talked about insulin resistance, how you can have normal blood sugars but still be at risk of developing type 2 diabetes. With insulin resistance, your cells are resisting the effects of insulin, and so your pancreas has to pump out more insulin. It overworks, and eventually what happens is insulin production slows down and blood sugars can start to rise. This can happen for several years before someone may actually develop type 2 diabetes. Looked at the difference between type 1 and type 2 diabetes, with type 2 being most of the cases of diabetes out there, but type 1 is an autoimmune disease where the body is unable to produce any insulin, whereas type 2 diabetes, the body is producing insulin, but it's not producing enough or the body isn't using it correctly. We looked at the different treatments for both type 1 and type 2 diabetes, as well as gestational diabetes. I talked about the polys, the early warning signs of diabetes, polydipsia, polyphagia, and polyuria. But let me again remind you, just because you have symptoms doesn't mean you have the disease. Long-term health consequences of poorly controlled or uncontrolled diabetes affect the blood vessels. It affects the tiny blood vessels known as capillaries in the eyes, the nerves, peripheral nerves, the ones that are farthest from the heart, and the kidney. Microvascular complications. Macrovascular are the larger diameter blood vessels that lead to the heart and the brain. Your discussion questions covered the case studies that were required for you to read, reviewing insulin and glucagon to maintain normal blood sugars, gestational diabetes. There were a lot of questions. Please have a look online. Today we finished carbohydrate disorders. Your discussion questions included making sure you knew the difference between lactose intolerance and milk allergy, reviewing insulin resistance, micro and macrovascular complications, lactate milk, the protein-sparing effect of carbohydrates, why it's important to consume carbohydrates, and how the body stores glucose in both the liver and the muscle, what the difference is between these two organs. So please remember to submit your journals by Sunday. Our exam starts October 20th after the Q&A, and it's due back on Thursday. All right, folks, good luck. Stay well.